Welcome this morning, everybody. It's great to be here. I am Brian LaGrasse. I'm the health director here in North Andover, and I'm here with Caroline Ibbotson, the public health nurse. So, a little talk on coronavirus. I know it's been a little bit scary. First thing I want to say is don't panic. I want to repeat that, don't panic. The media tends to throw out some very catchy headlines that kind of cause some fright and some scaring to people. So that's why I'm going to start out with don't panic. It's an evolving situation, but I want to know that we're here, we're doing a lot of work behind the scenes, and we're here to give you some information that is from the CDC, credible sources, the state, and local public health. First of all, what is the coronavirus? It's in the news, you guys have all heard about it. I want to give you some basic facts on what a coronavirus is. Coronaviruses are a large family of viruses that are very common in people and animals. Cats, bats, cattle, camels, people all get different strains of coronavirus. It's a respiratory virus that we got from an animal over in China that started to spread from person to person in Wuhan, China. So it spreads just like the flu, droplets, things like that. It's new to people, which is what is causing panic and scare and a lot of media coverage. Just like H1N1 was a few years back, we're all used to the flu. It comes around every year, but this was a new strain that hadn't been seen in a human population before. So there's concern as to how it's going to affect people, how it's going to transmit, and the severity of that particular virus and strain, whether it's the flu or COVID-19, which is the name of this current coronavirus. So coronaviruses have been around, like I said. The common cold is a strain of coronavirus. It's obviously mild. It comes around every year. There are various strains of the common cold, and there's no cure for that. That's why it comes back every year. SARS and MERS were also coronaviruses. SARS was in Canada a few years back. It was back in 2002. And that's severe acute respiratory syndrome. And MERS, which is the exact same thing but in the Middle East. So Middle Eastern respiratory syndrome. In this case, we don't know how it's going to affect people. They're gathering data and monitoring the situation across the world at this point. We're actually starting to learn the effects of this particular coronavirus, which is good. So they're gathering the data, they're seeing how it's transmitting, how it's affecting people, what populations are being affected the most. Some basic numbers, and these are changing literally every day depending on what site you go to and when they tally their last numbers. It's about 106,000 cases in the world, 3,500 deaths across the entire globe at this point. I suspect there are a lot of unreported cases, people that had mild symptoms that never reported it and never went to the doctors, never sought any type of medical attention, so they were never counted. And this started in Wuhan, China, which is a huge city it's bigger than New York City. It's got 11 million people in it. And obviously information coming from China can be suspect. They don't always report things correctly or to the right agencies or hold numbers back. And then if it was in rural China around the major metropolis, people may not have gone to see any type of doctor or get any treatment, so they're completely not counted. So they're thinking the numbers are obviously bigger in areas that weren't reported, which will decrease the mortality rate, and it's less severe in certain populations, which is what they're starting to see now. So obviously this is fluid. It's changing every day as new information comes out. As of now, Massachusetts has 1 confirmed case and 27 presumptive cases, which means they assume these people have the virus. They may have been tested and tested positive here at the state lab, and then those samples are then shipped off to the CDC down in Atlanta for actual confirmation. So one of those Massachusetts cases actually traveled to Wuhan, China, and got it overseas, and then came back, was quarantined and then isolated. He is obviously since recovered. And then the rest of the cases, or most of the rest of the cases, are from the Biogen conference that just happened recently, back in late February. And all those people are actually isolating at home, and they're kind of going on from there. So that's the basic, those are the numbers, that's what we're looking at right now. I'm going to pass it off to Caroline to talk about some signs and symptoms, and the severity and things like that, and then we'll keep the talk going. So.
Hi, I'm Caroline Ibbotson, the public health nurse, and just going to kind of go into some common questions that I happen to get from residents or organizations in town. I also want to touch upon the severity of the illness, and something interesting I had listened to over the weekend was how the mortality rate is going to shift and change from country to country because of the healthcare systems that we have in place. So, for example, back in the 1970s or 80s, they thought that Ebola had a 90% mortality rate when treated, and in the United States, the mortality rate actually went down to less than 20%. So it's kind of something that's still evolving, and it's just in the United States is still pretty new compared to what we've been seeing in China. So just to kind of say that. Also, current guidelines that are out right now are most likely to change as the situation continues to develop in the United States here. One of the common questions I get is, what can I do to protect myself from COVID-19 is what I'll be calling it, just for ease of reading everything off. So everything that you can do to protect yourself from COVID-19 is everything that you should already be doing to protect yourself from flu. So the virus is spread very similar to how the flu virus is spread, and that is through coughing and sneezing, through droplets, okay, in close contact within 6 feet of someone. So if you are out and about and you're washing your hands and washing them often with soap and water. Also if you're washing your hands in the bathroom, turn off the faucet with a paper towel and open the door with the paper towel rather than with your clean hands. If soap and water isn't available, to use a hand-based sanitizer with 60% alcohol or more. Always wash your hands if they're visibly dirty with soap and water. After going to the bathroom, before you're about to sit down and eat, and after blowing your nose, coughing, or sneezing are all just things you should be thinking about in terms of washing your hands. If you do have a cough or a sneeze, covering your cough or sneeze. If you have a tissue, you can cough or sneeze into the tissue, throw it away, then clean your hands afterwards because the tissue might get saturated with your germs. If a tissue isn't available, to cough into the bend of your elbow, and that way you're not coughing into your hands and then touching a surface. One of the other things is to clean and disinfect frequently touched surfaces and objects, because this virus, they're still testing how long it will stay on surfaces, but that is a possible spread of the virus as well, is if someone's contaminating their hand and then putting it on a surface, and then someone else goes and touches that and then touches their face. So wiping down, door handles, countertops, frequently high traffic areas where people are, constantly touching. The average person touches their face 2,000 to 3,000 times a day. So touching your eyes, your nose, your mouth with your unwashed hands, you're introducing bacteria, you're introducing the virus into your body. Close contact with people who are sick, try to avoid that if possible. And then also, this is the biggest thing, and it's the hardest thing for us, I think, as a society to do, is staying home if we are sick, because whether you don't have enough sick time or you need, childcare, or whatever the reason may be, I think we tend to kind of brush things off and say, oh no, I can work through it, I'm fine. And the biggest thing with this is to stay home if you're not feeling well, because as we protect ourselves, we're protecting other people, and therefore we're kind of decreasing our chances of getting sick. So it's kind of a circular balance here within the community. And it's also important to remember that diseases can make anyone sick, regardless of their race or ethnicity, and people of Asian descent, including Chinese Americans, are not more likely to get COVID-19 than any other American. So it's something that affects us all. Questions have come up about wearing a mask to protect yourself. So they are not recommending that masks are for well individuals. So if you are sick, a surgical mask would go over you so you're not coughing and sneezing into the environment. There's no evidence that wearing a mask will protect you from getting the illness because it doesn't filter out smaller particles. Some of the questions Brian had touched upon, but the definitions, what does it mean to be confirmed or presumptive positive, quarantined, or isolated? So basically when we started seeing cases in the United States, the CDC was the only one who was doing testing. And as they started to allow state laboratories to do testing, it was, okay, if someone comes back positive within a state, the CDC still needs to run the test and confirm that they are truly a positive. So as Brian was saying, we have 1 confirmed case right now and 27 presumptive cases. So they're presumptive positive. When we test them and they're positive, they do not become a confirmed case until the CDC tests them and they become positive. Isolation refers to those who have symptoms of the illness that test positive. And then you've probably heard in the news, self-quarantine or people who are staying at home and quarantining. That is an ask that the State Department and the local boards of health are asking people who don't have any symptoms but who have been exposed to someone who has symptoms or who has the disease or who have had recent travel to some of those high transmission countries. Next question was, how are residents being monitored for compliance with isolation and quarantine? We are working with the State Department in terms of follow-up of what individuals may have been exposed and what individuals need some active monitoring from local boards of health. What we do is when we're notified of that individual, we will call and check in with them, making sure that they're staying home for the 14-day period, and also seeing if any symptoms develop. If symptoms develop in this person, then we touch base with the Massachusetts State Public Health Department, and we get guidance from them as to what is, they'll probably continue to stay home another 14 days on top of when their symptoms develop. So everything's kind of being taken care of as a case-by-case situation. Right now, we have a couple travel alerts within, so the CDC rates certain countries as a level 3, level 2, and level 1. Level 3 countries that have a travel alert currently are China, Iran, Italy, and South Korea. The CDC has asked to avoid all non-essential travel to these level 3 countries. Older individuals and those with chronic health conditions are asked to avoid non-essential travel to level 2 countries, which is currently just Japan. Other travel recommendations and guidance, foreign nationals at this time are not to enter the United States from China or Iran. All residents returning from a level 3 country will be asked to stay home for a period of 14 days from the time they left the country to monitor for the development of illness. So if someone is flying in from Italy or South Korea or China, they will be asked to stay home for 14 days from when they arrive in the United States. That is to monitor to see if any symptoms develop. Any U.S. residents returning from China or Iran will actually be routed to, they have 11 designated airports in the United States. Logan is not one of them. That will screen for the individuals coming back from China and Iran, and they will do a health assessment and a travel history on them, depending on what, if they have a fever, they might be asked to quarantine at the base or, somewhere. I think there's a couple places on the West Coast. And if they have no symptoms and they're doing okay, then they will be asked to come back but quarantine at home. So there's a couple different situations that might go on at that level. The North Andover Health Department's, like I said, notified by the Department of Public Health at the state level to individuals that will need follow-up from us. Also, those that have completed quarantine or have been released from isolation do not pose a risk of infection to other people. So once they have completed that 14-day, and it's not always just 14 days, it's, again, we're on a daily basis asking them, do you have a fever? Are your symptoms gone? So if they start to develop symptoms, it might be longer than 14 days. And so, that's based on public health and the state in terms of how long that is. But once they are considered off isolation or quarantine, they are not a risk of spreading the disease. Another question we get is what to do, what do I do if I get sick? So there are many cold and viruses circulating right now at this time of year, and symptoms for COVID-19 are very similar to flu symptoms. So the common symptoms can be as easy as the common cold, but then they can be as severe as pneumonia. So some of the most frequent symptoms we see are fever, cough, and shortness of breath. So those are the three ones that they're saying to kind of keep an eye out for. 80% of the cases that are reporting symptoms are mild symptoms at this time. I've also heard a lot of people saying, well, what if I'm sick? I heard I can't go to the doctor. I can't see my primary care. That is not the case. So your doctor and the hospitals are only asking that if you are sick and if you have traveled to one of these countries, or if you have had close contact with a positive case, to call ahead of time and give them the information that you have traveled to China or South Korea and that you are now having a fever or a cough, so they can have the appropriate staff and the appropriate protective wear for when you come in. So that's all that they're asking, is that if you call 911, let the first responders know that they need to put on a mask, they need to put on a gown before they come into your house or apartment, because to further prevent the spread of the illness. Testing for the illness right now is very strict guidelines. Like I said, it's if you have had travel to one of the level 3 countries, if you've had direct contact with a positive case, and if you have symptoms, and if you don't have another illness that fits the criteria. So, for instance, if someone had second-degree contact with someone and then they had a fever, cough, but they tested positive for the flu, they're not going to test them for COVID at this time. And just other updates are, like I said, guidance is going to be changing as this continues to develop in the United States and develop within our community. So we want to make sure everyone's getting the most accurate information. We have put out a few news alerts, but they have gone out maybe in a way that not everyone gets the information, whether it be email or social media. So if there's a way that the majority of people get their information and say, you know what, can you throw it in the newspaper as well? Just let us know, because we want to cover our, be most efficient and effective for all of the community. And other websites, I did put on the last page of the handout just information in terms of web pages you can look at. We're going to be updating our web page. We put our news alert on there, but we're going to start putting some links as well to bring you right to either the Mass Department of Public Health or the CDC website, and any other recommendations or information we can put on there. But then if you have I just put in the little, the State Department, if you have recently traveled to any countries of high transmission, you have symptoms of respiratory illness, who you're supposed to contact. So I put the Health Department's phone number there, the Massachusetts epidemiologist's phone number there. So if we can't be reached, it's a weekend, you call the state and they will direct you on what to do. And that is all I have for my information, so we're going to open it up to questions. Yes?
It says to avoid traveling to these countries. However, is there a date or time already set? I know you don't know if it's going to continue for 3 months or whatever, but at this time, is there a date that it's unsafe to go to those countries?
Meaning, is it going to be in effect till July,
I have
kind of
family
thing?
members that are planning on going May.
Mhm.
They're watching it very carefully as to whether they should or shouldn't, and I'm just kind of curious in that. Is that unrealistic to think that it could be over by that time or not?
So from what I've heard, they're kind of just taking it as it comes at this time. I think May is quicker than we realize, and so I don't, if anything, I can see it expanding more, rather than them saying, okay, we're going to release this travel alert because of how other countries are, being affected by it as well. But I'll let Brian, if you have any.
No, that's what I'm going to say. There's
Yes.
an ongoing situation.
I saw the movie this weekend. They made in 2010. Show what happened exactly today. How come? They show what happened today 10 years before.
Yeah.
I think I just actually heard about that movie with Kate Winslet.
Now that happened.
I need to watch it. I don't know. Well, because, so, and I'm not going to say it as well as some of the doctors that I listen to, but I listened to a podcast about this over the weekend, and one of the clinicians who was speaking was saying how this is, you know, in 2003 we saw SARS, in 2012 we saw MERS, which is the, you know, the other coronaviruses that Brian was speaking of. And because of the way our world is developing, we are so interconnected. Something that's happening in China or is going to be affecting us. We can't assume that it's not. We're a high travel, you know, country. Everyone is going back and forth for work or whatnot. And so also he had talked about how we are so interconnected with our environment and how there is going to be this continuous cross contamination, or however you want to put it. And like I said, I'm not going to say it as eloquently as he did, but this is something that I think is going to continue to be part of our life and how we adapt to it and how we prepare for it.
Yeah.
So I think that's how 2010 was probably based on what happened in 2003 and you know what I mean? Like, I think it is known that this is going to continue to kind of
They
be.
show study in China, exactly everything, nothing changed.
Yeah.
It's like it predicted the future, so
Yeah.
it's kind of weird.
Good
Yeah.
question.
Question over here.
Yes.
You gave my wife, when I flu shots, pneumonia shots.
Yes.
I've experienced one death related to coronavirus.
Mhm.
The flu probably in this state has already killed everyone, 200 or 300 people already,
Right.
right?
I think this season,
20 or 30,000 in the country.
yes. Last year I think there was 35,000 flu deaths.
Coronas is one
Correct.
verified. So 200 or 300 people in the state have already died from the flu.
Might be
Not
more.
that?
I think nationally it's 18,000 have died this year from the flu.
18,000.
Yes.
So I said just 200 or
Correct.
300 already died from the flu we get every year.
That's what I was
So-
saying. Don't panic.
That's it, that's what I'm saying.
The flu you guys see every year. The flu has been more severe so far.
Oh, yeah.
Like I said, so 18,000 deaths this flu season. It's usually about 35,000, give or take. But so the flu, and that spreads the exact same way as the flu, like we talked about. So do your flu precautions. It's going to be the exact same thing for COVID-19. In the back.
You know what I was surprised to see? Logan wasn't one of those airports that was mentioned, and it's such a highly traveled area. I was just surprised to see Logan wasn't on that list of airports.
I think because the majority of people are coming from Japan or China, and they typically travel to the West Coast from those areas, is my assumption. Well, that's different, yeah, but now they've already set up the, you know. Yes.
It's not like a complex where I live. One person gets it in there, is the whole complex gonna be?
No, so it's considered close contact. So if someone in an apartment is under quarantine or ill and they are staying at home, within that apartment, they should, you know, if they need to come out of and go get their mail or something, they need to put a surgical mask on. But typically they have to stay in their apartment. And those are all individual apartments, correct?
Yeah.
Yeah. So it's
But they're
from.
not airtight or anything.
Right, so it's not airborne. It's not an airborne.
it's not
No, it's
airborne.
droplet. No.
Close contact.
Yep. So it's close contact. It's droplet. It's not airborne.
Don't share the beer.
Yes. Yes.
My daughter lives in Kirkland, Washington.
Mm-hmm.
And of course, we all know that was sort of the worst thing on. They closed all the senior centers in Kirkland and in Seattle, which of course is bad. And my question to you is, I did bring it up here last week. I have another friend that lives in California who plays bridge all the time at a senior center. That is no longer being offered because the cards create terms. What do you think about that?
I think that Washington State and California saw the first of the illnesses that the United States have seen. We are now starting to see more activity in Massachusetts. Our first case was at the very beginning of February. Our second case wasn't until the very beginning of March. So it was slow to kind of come over here. And like Brian said, the conference that was held in Boston, did pick up our numbers this past week. Our state health department is phenomenal at getting information out to all of us. We are on weekly conference calls with the state. They're also reaching out to all the schools. Superintendents have conference calls. They've reached out to all the long-term care facilities. And so there is a lot of guidance out there. And I think as this develops, those conversations are going to have to be had across our community as well.
Why is it that there's so many people who are
Sorry, I'll
dying
get
from
to
the
this.
flu, and the flu symptoms are so similar, and we make such a big issue out of this coronavirus that is so much less?
Related
I
question.
mean, they're not closing everything down because of the flu for years and years and years. And they're not closing schools down, they're not saying you can't go to these sports events, they're gonna be playing without people. But now with this, which has got far fewer people, we're going into this craziness of watching out. People aren't going to church, they're not.
So the question was, if this is so similar to the flu, why do we not already do all this already with the flu? Why aren't we closing schools? Why aren't we, closing mass? And I think, and I'll answer some of this and let Brian take over. My understanding is that this is so new and so unknown, and I think we know a lot about flu. They've been dealing with vaccines for quite some time. I think this is so new, and the mortality rate is at this time slightly higher than what flu is. But like I said earlier, that's going to change country to country based on the person, the disease, but also the healthcare system that's in place. And as they start testing more. So right now the testing criteria is so strict that once they start testing people more and they find how many people have had the mild disease, and I think that mortality figure will go down a little bit. So I think that's what it is. It's just so quickly developing that's my take of the situation.
Yeah, and the thing is when you have a novel strain, the same thing happened with H1N1 because it was a flu virus we hadn't seen before. So you don't know how severe it's going to be. You don't know the effects and how much it's going to spread. So the unknown, I think, is what causes the most fear. How's it going to affect the older adults? How's it going to affect children? What's going to be the duration of the event? Whereas with H1N1, we had 2 events. It was the initial wave of the flu, the H1N1, then it waned down a little bit during the summer months and came back again in the fall. There was also no vaccine for that particular strain, so they had to create one, and that took almost a year. Same thing with this coronavirus, COVID-19. They're doing vaccine trials now, but they won't be ready for use for about a year. So without having a vaccine, without knowing the complete effects of that strain, causes a lot of unknown fear. Basically, same thing as flu for this, but so basic preparedness. You guys should have your stuff at home. You should have your non-perishables on hand in case it gets more severe. Also talk to your doctor about mail-order prescriptions. If there is the case where we're doing any type of social isolations, closing senior centers, things like that, a way to limit your public exposure is always good to think about. So less trips to the grocery store, less trips to the doctor's office or pharmacy, things like that you can think about. And we have lists, and CDC has lists on their website about things you can do to prepare. Also, we call it a buddy system. Back in the Boy Scouts, we had it way back in the day when I was a Boy Scout. But have your contacts. Let your friends, your family, people know who your doctors are, their contact information, what medications you're on, and what the dosage is. In case you ever need to have somebody get it for you, they know where to go and how to get it. So things like that you want to definitely think about. So yes, back to your question, the unknown is what causes the most fear.
Did you have a question?
Well, my question was kind of similar, because you said, like, for the SARS, for instance, you didn't know what it was and all of that kind of stuff. So my question is, what makes this virus so much worse that you cannot turn on a TV, a radio? We are getting so bombarded. So why the hype for this when there wasn't before? Is this the media it's creating so much anxiety?
One word answer to that is yes.
Because we are, as my son said to me the other day, you know, Mom, this really affects the elderly more. You know, of course,
Yeah.
I don't see myself as elderly, but I guess my son does, you know?
So, okay.
And so, what makes this so special?
I think because it's new and the catchy headlines, they get your attention, they draw you in,
Yeah.
and then you watch. So a flashy headline might have one small tidbit in the actual story,
Yeah.
but it's an eye catcher. So in the newspapers or on TV in the media, they do sensationalize it, which helps cause the fear and the panic. So that's,
And what can people do to combat that?
Shut the TV.
you can go
Turn it
to,
off?
I recommend,
Well, except
honestly,
everybody in this room has already been hearing about it
Yep.
and stuff on TV, but still we came today.
good, I'm
to
glad
hear
you did.
more.
So you want to go
You
to
know.
your credible information sources. So
Okay.
CDC website, the mass.gov, our website, are going to have the vetted information from the doctors, from the World Health Organization, from every state department across the country, getting the correct information, the numbers, the effects, the severity of the illness, all reported and then promoted without a catchy headline. Just the information,
Right.
just stuff that you need to know.
So are there any antibiotics yet that seem to have any effect on it? I know they're working on creating a vaccine. That'll take a year.
So there's currently no treatment for it. They are using some antivirals. However, the complete effectiveness of them is really unknown still. They are working on a vaccine. However, there's a process to vaccines because you have two parts of the vaccine process that can be expedited and rushed, and that's usually the beginning part where they're developing the vaccines. They get all hands on deck. They develop it. And then the end part of the vaccine when they're, distributing it out, and they can rush those two pieces. The middle part is where they're doing the testing on subjects, and that part is the waiting period. And so I think what happened with SARS is that I don't think it was as quickly or easily spread. I'm not quite sure of the exact timeline of it, but that's from what my understanding in comparison to these two illnesses. They developed a vaccine for SARS, but by the time the vaccine was ready, SARS was over. So, they're developing a vaccine and they're working on it, but who's to say where that will come into play when it's ready and where we're going to be looking. I just don't know at this point. But there is no medication other than just kind of taking care of your symptoms if you're in the hospital.
Fluids, lots of fluids.
Yeah, so if you're in the hospital and if you have a severe illness like pneumonia and you maybe need oxygen therapy or whatever, you'll be in, one of the local hospitals or wherever, they'll be giving you the care that you need. Here, if you're home in your apartment, yes, getting plenty of rest, keeping your fevers down with Tylenol or ibuprofen, and then, staying hydrated and drinking plenty.
One thing I want to add to that question. So obviously, you guys have gotten your flu shots, your pneumonia shots, things like that. But what I can ask you to do is tell everybody you know, get your flu shot and get your pneumonia shot. Your family, friends, people you hang out with outside of here, advise them to get their flu shot and then actual pneumonia shot. What that is for, basically, is if you have your flu shot, it's going to lessen the effects of the flu on you if you do contract it. One of the severe effects of the flu is pneumonia. So by you not getting a severe illness, not getting pneumonia, it's going to save your body's ability to fight other viruses and bacteria, such as COVID-19. So if you're healthier, if you have your flu shot, if you fight it off quickly and easily, your body's in a great position to fight off everything else. What that's going to do is going to save you, and it's going to save you from going to a hospital and getting medical care if it gets to that stage, which will take hospital staff time and resources away from other people that may have COVID-19 and may have severe complications with it. And pneumonia obviously is a side effect of both of these viruses. So that protects you from both. So highly recommend that, and tell all your friends and your family. If they're old enough and they have the right coverage, get their stuff and get it taken care of. And Joe's been asking for a long time
Yeah,
here.
first, this is a very good brochure that you put together.
Thank you.
What our town is going to do the best we can to keep people apprised of this coronavirus. It was a major topic of discussion this past Thursday night at our Board of Health meeting, as it will be going forward. It's the fourth Thursday, by the way, of each month at 7 o'clock, and it's repeated 3 or 4 times over the course of the month. So if you ever want to know what we're talking about at any board meeting, go to North Andover GovCAM, and you can just tune in and watch. The media. If you look at the TV, talking heads, and the newspapers, bad news is always front page. And what they do is they often exacerbate the problem to make it worse than what it is. For example, in the United States, about 50, 60,000 people die a year of the flu and also of pneumonia. And this is a fraction of that, but this is new and we don't fully understand at this particular time. And it is a little bit scary when you say that the shot is not going to be available for like another year or so. You know, who knows what's going to happen between now and then? I know the stock market was closed this morning because it went down 7% within the first two minutes. It's all fair. That's what it's based upon. Fair. People just don't know. They
Correct.
And what I'm also fearful of too is both the Republican Party and the Democratic Party of the United States are going to berate each other, saying that they're not doing enough. They don't work together, and that's only going to exacerbate the problem and make people that much more fearful. Walking to politics in the United States, that's just the way it is. Question, worst case scenario, and I imagine that the state is preparing right now for that. Say the same thing happens here as has happened in Milan. As we know, northern Italy, 16,000, 19,000 people have been quarantined. Worst case scenario, what type of plans are in place from the perspective of the state and the federal government, if any at all?
A lot of it, I mean, we've been planning on this for a long time. We actually did a tabletop exercise in January with public safety and public health across the region on this type of exact situation. This is prior to COVID-19 even being known. We did a tabletop exercise in Methuen with 8 surrounding communities, with town manager, public safety officials, public health officials on this exact type of situation. We've had plans in place since H1N1, so we dusted those off, took a look at them, met. We've had emergency management team meetings so far, the tabletop exercise and ongoing conference calls and information sharing to make sure that the effects are as least as possible. It's going to be a long-term event, is what it's looking like, with a slow progression and a slow transmission of COVID-19. So continuity of operations is something that we've been planning on for a long time. So each department in town, police, fire, DPW, all have plans in place to get their jobs accomplished with a reduced workforce. Prioritizing your tasks, prioritizing your functions as a department and as a town itself. So there are things that we can do in terms of recommendations for social isolation, limiting or canceling events to slow that transmission. If there's a higher absenteeism, if there's a higher workforce reduction in services, things like that. So basic functions will go on. Some things may be scaled back just to keep the prioritized functions going as normal. So that's a fluid situation, and that's going to change depending on how many people are actually out of work and what the situation is. What's the supply inventory? We've already gone through our supplies. We have supplies for a pandemic. We have, obviously they're limited, and we have some things to get us through the initial phase, the initial wave of that. So we're monitoring it, we're working on it, we're talking about it, we're meeting on it, we are documenting everything. We have our emergency dispensing site plans dusted off and ready to go when the vaccine comes out. So there are things that are being worked on every day.
I'm just wondering what the chain of command is. For example, does the town manager, does the city mayor have the unilateral authority to shut down the schools, to close town hall, to close all public services? I'm asking because I really don't know. I know they have power, but I don't know the depth of their power, particularly during a potential, I'm not even going to say pandemic because it's not.
There are
potential
things.
issue of concern.
I don't think things would be closed in terms of town hall. There may be reduced hours or reduced workforce or limited functions, but with the Board of Selectmen, the town manager, and the staff that go down below her, you have a chain of command. Same thing with the police department and fire department. If somebody is sick, then the next person steps up and they're in charge until that person comes back. So, continuity of operations. We have that already documented and ready to go. And we'll go from there. And depending on how it evolves and how the situation changes every day, we'll make do with what we have and get our jobs done and keep the town running effectively.
Can I comment on that?
Yep.
Also, just to add to what Brian said, typically we get our guidance from the Massachusetts State Public Health Department. They are the ones who monitor every community within our state, and they say, okay, this is what's going on. To answer your question a little more specifically, there are towns that have superintendents who have maybe had guidance or shut down schools beyond what the state had recommended. So I think there's, depending on what the community is seeing and what we have for resources, I think it can be kind of a situation where you get your guidance, but then you can also make a determination based on your community, is what I understood from other communities already.
And the town has the ability to, if there's an issue with a certain school, that school can close down for a certain period of time. The schools are going through increased hand washing protocols. I've met with them already a few times. They are monitoring their students and their absenteeism. If there's a situation in a particular school, which has happened here and in other places across the Commonwealth where there's a norovirus outbreak in a school, that school in itself may close down to stop the transmission of the virus in that school. So that's an option on the table if it comes to that, and we talk about it all the time. So it's monitoring and then making decisions based on the information you have. So we do have the ability to do things like that if the situation requires that's what is needed to be done.
Yeah, you talked about the importance of sanitizing things and wiping door handles and everything.
Yep.
I guess my question might be more to Irene over there, but what is the senior center doing right now? I mean, are they, wiping the door handles down every hour because there's so many of us? There's lots of tables in the other room. Are they being wiped down, with something, like Clorox or whatever they do? So what is the senior center basically doing to help us, and how are they tracking if anybody is sick?
Right now, the state is tracking, and like I said, we've got some very preliminary numbers. They're very low still.
Yeah.
We're still at very low risk.
Right.
So if that risk increases, protocols
Yeah.
can be put in place.
She's
And
trying to leave.
protocols can be put in place
Yeah.
right away to
Yeah.
combat that.
But
And
what
it
is-
would be exactly what you said. It would be wiping down the door handles more often. It would be sanitizing the flat surfaces more often. Things like that. And then education of everybody coming in.
Right.
Make sure you wash your hands. Don't touch your eyes, nose, mouth. So that will be done, and that is on the table. So right now we don't have any positives in this area. We don't have any
Right.
risk, but that will be definitely talked about, and it can be implemented very easily.
But is the senior center doing anything extra
I
now?
haven't met with Irene yes, they are.
Things are being looked at constantly.
Yep, there you go.
And it should all be stuff that we do normally during flu season, you know what I mean? So
Right.
if anything,
Right.
this just reminds us of all the practices we should be doing on a
Right.
regular basis. Go ahead.
What are you suggesting for the person that has some health, they're compromised in their health issues right now? I mean, I know they say to stay in and not, but how long is this gonna go on for? I mean, you recommended that they can go out into crowds, or I'm just talking the food store, or the senior center, or whatever, and what precautions? I mean, I know they're at a higher risk, I mean, we're gonna stay shut in for, a long period of time, or what are your real suggestions for someone like that?
Suggestions are take the precautions they feel are best suited for them. So maybe not going out as much. I mean, right now, like I said, it's still a low risk because it's been a few isolated pockets here in Massachusetts, but that will probably increase. We don't know if it's going to be a long duration or if it's going to come and go in waves like the H1N1 did. So depending on how it evolves, and that's one thing you want to basically keep track of and keep tabs on in the news or the CDC website, our website. Touching your face, washing your hands. Like I said, those are the basic things to do to keep yourself from contracting the virus. Yeah, I know, but
Going out into the community a little bit, like my husband said, am I going to be shut in for months? You know, or what do we?
if it becomes a widespread issue here in the near future, you may want to think about taking precautions like that. Not going out as much, getting mail order prescriptions, things like that. So that's up, and we'll have more information on that as this evolves. But it's taking basic common sense precautions to not contract the virus or even the flu. If they're immunocompromised right now, the flu is going around, the flu is prevalent here and present. So you want to take care of yourself for the flu as well as COVID-19. Janine?
Ron, what would you recommend as sanitizing for your surfaces at home? Would you recommend bleaching water or hydrogen peroxide? Bleaching water or?
I would go bleach and water, Clorox wipes, any type of sanitizer, cleaner.
So hydrogen peroxide, even though it's less toxic than bleach?
The recommendation we've been hearing is alcohol-based sanitizers and bleach. Hydrogen peroxide probably works too. I haven't looked into that yet. I haven't had that question, but she's got
There's
it.
a list of EPA-approved products that are, I guess, approved for killing this virus, and I can get that on the web page. It's like 5 pages long and 7 font, but I can try to track that down and. Yeah, so there's cleaning and disinfecting. I mean, cleaning's going to kill bacteria, and just every day, and the more you clean your hands, you clean your surfaces, you're less likely, but then there's disinfecting, which is the hard, bleach, and I don't know about hydrogen peroxide, but I can try to track down that list and get it circulating.
I got something on the internet this morning that said 2/3 of a cup of alcohol, rubbing alcohol, and 1/3 of a cup of aloe vera gel.
To make your own hand sanitizer.
Make
Yes.
your own hand.
I think she was talking about cleaning surfaces. Yeah, but I've heard that too.
I mean, right now you can't buy
I know.
alcohol. They said it has to be 60% alcohol based.
Mhm.
Forget it.
Yeah.
You can't find it anywhere.
Yes.
Yeah.
I heard that the warmer weather should take care of this whole virus situation, and it won't continue once the warm weather comes. Now, assuming we have warm weather before too long, what do you think about that? And the other question is, why have we not heard of this being in Central America, South America, Scandinavia, many parts of the world? It seems to be Italy, South Korea, United States. We don't even hear about Canada.
I think it's more about which countries have the higher rates of transmission right now. So China, Iran, like the higher number of cases.
But there are a lot of people, they say, that have not traveled anywhere, that they don't really know where they get it from. But we don't hear of these other countries.
Right, so it is transferred from person to person, but then I think they're just doing the highest risk right now, just for testing and they can't limit everyone that comes into the United States, so they're saying people that are coming from Wuhan, China, or from, Italy, or from Iran or South Korea, then we're going to ask you to
Well, I
self-quarantine.
guess I wasn't so concerned with testing as I was, why don't we even hear of somebody in South America that has?
They're all over the world.
There's 99 countries that are, it's around.
It seems to be United States,
There are
Korea.
100 countries across the globe, including South America, Central America, Canada, Australia, all across Europe, all have cases. It's the cases, the high transmission rates, and the thousands and thousands of cases like in Wuhan, China, and all around mainland China now that you hear about. Iran's got a huge outbreak as well. So countries across the globe do have it. It's the major outbreaks that they're the level 3 travel advisories for: China, Iran, Italy, where they have giant community spread, community acquired COVID-19. Whereas
We'll see a change when the warm weather comes.
I hope so. I know that certain viruses, even the flu, takes a dive in the summer. H1N1 did the exact same thing, but this we don't know.
But also with H1N1, I know there were communities that closed their schools in the spring with H1N1, and then kids came back in the fall and had to close their schools again because they saw another wave of it. So it's really hard to say at this point.
Yeah,
Jose?
I disinfected the van every single day 13 years ago.
Okay.
Way before this happened. All the seatbelt,
Oh, good.
the handle, everything
We're going on
inside.
a trip today.
And number two, the good thing about this is the airline ticket and the
Yeah.
cruise is really cheap now.
Right.
Yeah.
You can rebook your trips. You had to cancel.
Janine?
I wanted to ask you, if in your discussion with the region and board, you ever discussed a point at which this would be uncontrollable and you would have to isolate and house a large amount of people? Are there any facilities, because I know of one in our community that could house thousands of people?
I don't believe we've discussed that dire a circumstantial situation. And then to house that many people in one location may be an issue unless they're all sick. Then it would be an isolation center with all people that have been positive. But the hospitals do planning as well. We work with the hospitals on a regional basis, and they have their surge capacity plans. They have got a lot of things lined up if there was a huge surge, in terms of even using other buildings to have medical centers set up. They don't want to do that ever. They have plans right now to basically isolate and use every spot in their entire hospitals, including hallways, to house sick patients of an emerging infectious disease, which is what we call them, EIDs. Yes.
Some of us have noticed that in the supermarkets, the cleansing products have been raised, the prices have gone up. Say it was $2.29 last week, this week it was like $2.79 or $2.89. And that's like, I feel it's like taking advantage.
It might be because they're paying more to get it, which is I've noticed too, just to get it from a distributor. They're because it's just supply and demand. Yeah.
So,
Go ahead, Janine.
I just wanted to remind you all that this started in China, we all know that. But they have bombastic rules. They have open markets where they kill animals that people want to buy. So if this came from an animal, it makes sense to me that it probably started that way.
That's what they believe came from a market in China, Wuhan, China. Different culture, different set of criteria for their rules in food safety and sanitation, which we're in control of over here, right, Steve? There you go.
How safe is it to go out to eat?
Yeah.
Restaurants?
For food sanitation wise or virus wise? It's safe. It's still safe to go out to eat. Right now, Massachusetts doesn't have widespread community transmission. That may change later, and there may be new recommendations coming out. But as of right now, we're still listed as a low-risk population in state.
We'll have to get some tequila, that's 60% alcohol. That'll take care of it.
Open up a bottle of scotch.
Do we buy food from China in our frozen food section?
I believe food is, yes.
Is there any regulations when that comes into the country?
That is the FDA, and I believe there are regulations and criteria that these shipments have to meet. But that's not done at the local level, that's done at the federal level. Hi, Irene.
Do you know, because you said it comes from droplets spreading how long does the droplet contain the virus? I mean, is it something that?
They're still looking into that. They're saying 48 hours as like a
General.
hopefully like the longest, but they're really not sure if it's hours or days. They're still investigating that.
What about the airplanes like locally, like flying to Miami or something?
I know I have family that work on the airlines. I know they are, spraying those planes down. They're, cleaning surfaces between every flight. So
Don't get on a plane. You've been on them over the years. Everybody gets into a cold and normal. Everybody gets flu on the freaking planes.
Yeah.
They're terrible. And they're confined. you're gonna be 300 people, you know, in a little compartment.
Well, I
Your question?
read it saying that the airplane is safe right now because of the way they circulate the air. It's very highly circulated and.
It's filtered.
And all the travel alerts right now are on the CDC website, and really the high-risk ones are the level 3, level 2, and even some of the level 1s. But within the United States, I have not seen or heard any travel
I
alerts.
also heard on the news, take a window seat, they're the safest.
Get a question over here from this gentleman right here.
Joe.
You get a question right here.
What did he just say?
I didn't hear it.
What did he just say? There was-
Oh, the window seat is the
The
safest seat.
safest.
Safest, good thing.
That's because you can open it for a breeze.
Yeah.
A big breeze.
You have a question?
It concerns me that for weeks, if not months, the CDC has said they do not know how long the virus can live outside the host. But it would seem like a simple matter of putting the virus on a slide, set the slide on a shelf for a day, and then go back and look at it. And it makes me concerned because I think they do know the answer. It's a long period of time, not 48 hours.
Could be
And
longer.
they don't want to tell us.
It's very possible. I think it also depends on the environment. I think it depends on the droplet size. I think it depends on the virus itself, which is what they're probably trying to figure out. And I don't know how long it's going to take, but hopefully they get that out
They
to
can
us sooner rather than later.
Release a range, they won't do that,
Correct.
so I really think they know, and they won't help, and it's not good enough.
Okay.
Okay, the other thing, can this be transmitted by birds?
I have not heard of any bird transmission, and I don't think they've
That's what
had.
the CDC says, they don't know, and I don't understand why they don't know that. All you gotta do is get a bird, draw blood.
Okay. Anybody else? Thank you very much for coming, Joe.
Yeah. Just a quick one. Hand sanitizer. Seems to be a mixed bag, because if you put too much, and it's basically rubbing alcohol, if you put too much on your hands too frequent, you'll dry your hands, crack your hands, and those are different sites that the virus can get into your bloodstream.
Mhm.
So you have to be very, very careful if you wash your hands and sanitize your hands. Washing your hands is fine, but sanitizing is a different story. And as I said last Tuesday night at the Board of Health meeting, I worked in China for a year, and Thailand for a year, and I have a pretty good idea of their culture. Yeah, in China it is an open food market. It's a killing field. That's what it is. And if you talk about the SARS, they feel that the SARS is from the bats to civet cats, a delicacy. They eat millions of them. These are wild animals, and that's how the virus was transmitted to humans. If you talk about the MERS, it seems to be from bats to camels to people. Here we feel it's from bats to some animals to people. Now they're closing these up, and it's disgusting. You go to China, even if you want a puppy to eat, they'll kill it for you right there, a cat.
Those dogs are cats in China. They eat
What?
them all.
They're food. They're food. Last year, over 10 million dogs were killed for consumption in China, and over 5 million cats. They're food. It's food in China. You know, so basically, if it's alive, they'll kill it for you, right in front of you. Fresh. Yeah, fresh after it has the virus in it. So
All right.
it's a problem.
All right, well, on that note, thank you guys, everybody, for coming out. We appreciate your time.
Thank you.
You know how to get in touch with us if you have any questions or need anything, okay?